Lymphatic system. Lymphatic system is looked on as the immune system of the body and supplement for the circulatory system. It is composed of lymph, lymphatic vessels, lymphatic nodes, and lymphatic organs. Lymph is the milky interstitial fluid drained from the cells and tissues which is not reabsorbed by capillaries and returns to the circulatory system. Lymphatic vessels transport the lymph from the extremities to the veins and then to the heart. Lymph drainage from the left and right side of the body is different. Thoracic duct, the largest lymphatic vessel, collects the entire left side of the body and 3/4 of whole body lymphatic drainage and moves into the left subclavian vein. The right lymphatic duct is only responsible for the upper part of the right body side lymphatic drainage. The MLD, manual lymphatic drainage, massage is using the tender effleurage towards the heart to release the lymphatic edema, the non-pitting edema that happened after surgical operation. Lymphatic nodes are called swollen glands found under the skin in the body. However, lymphatic nodes are the expansion of the lymphatic vessels instead. The swollen lymphatic nodes are often the sign of inflammation even in the tumor of the affected region. In massage therapy, there are several endangerment sites that need to be cautious or avoid touching where the lymph nodes accumulate. They are anterior cervical triangle, formed by middle line of neck, inferior margin of mandible bone and medial side of SCM, sternocleidomastoid, muscle. Lymphatic organs include spleen and thymus. Spleen is the largest lymphatic organ which is located on the left upper abdomen and filters the blood to remove the old and damaged red blood cells. The thymus located in the middle line of the chest behind the sternum bone. It is the schoolhouse to train the immune cells into T cells, the white blood cells to attack infections and tumor cells. Respiratory system. The respiratory system consists of nasal cavities plus paranasal sinus, nostril, oral cavities, pharynx, larynx, trachea, left and right main bronchus, left and right lungs and diaphragm. The sinus is the hollow space filled with air within the bones between the eyes, behind the cheekbones and in the forehead. Respiratory system is also called respiratory tract, the endpoint of which is alveoli, the air sac made of a thin layer of epithelial cells to exchange the oxygen and carbon dioxide in the bloodstream of capillaries covering above. The airway of the bronchus is influenced by the smooth muscle wrapping around it. If the smooth muscle tightens, the bronchus lining will be swollen with excess mucus. That is how asthma happens. Diaphragm is a parachute-shaped respiratory muscle which belongs to skeletal muscle. When breathing in, the chest expands, and the diaphragm contracts and descends to make capacity for air to inhale. When breathing out, the chest falls due to gravity and the diaphragm relaxes and ascends because of elasticity to exhale or compress the air out. Diaphragm is not only the horizontal plane to separate the thoracic and abdominal cavities, but also provides holes for esophagus, aorta, and vena cava to go through.